All right, good afternoon or morning or evening to everyone, depending on where you are in the world as you join us today. We are seeing folks, participants come into the webinar, and so we will get started in just a moment. Our J Street webinar on the humanitarian crisis in Gaza. So we're just going to give it a few more seconds for folks to join us, and we will get started. Okay, I think we will now get started. So welcome everyone who's joining us to J Street's briefing on the humanitarian crisis in Gaza. I'm Deborah Shushan, the Director of Policy at J Street. We have convened this very important webinar today to talk about what I'm sure everyone who is joining us knows is a particularly dire humanitarian situation in the Gaza Strip that has unfolded during the war between Israel and Hamas, which of course followed the horrific Hamas attack on Israel on October 7th, which J Street, of course, has very, very strongly condemned. We are also extremely concerned about the hostage situation and hoping that there will be good news soon about a deal that will bring about the release of the hostages that were taken from Israel, that will also involve a substantial humanitarian pause in the fighting that will enable the surging of humanitarian assistance into the Gaza Strip. So we are eagerly awaiting news about that, about whether a deal will move forward, and we strongly hope that it does. And again, here we are going to be focusing on the humanitarian crisis that is unfolding and worsening in Gaza. So I will introduce our two speakers in just a second. I will just mention before I do that, that as with all of our J Street webinars, it's very important for us to give our participants, our audience members, an opportunity to ask their questions. And so during the webinar, I invite you, our audience, to put any questions that you may have into the Q&A at the bottom of your screen. And I will do my very best to ask as many of those questions of our two speakers as I possibly can. So without further ado, I'm going to introduce our two speakers who are both from fantastic organizations that are doing such important work at this time. And I will start with Tania Hary, who is the executive director of Gisha, which is the Legal Center for Freedom of Movement. As many of you will already know, it is an Israeli human rights organization that promotes the right to movement in the occupied Palestinian territory and especially the Gaza Strip. It is Israel's only organization that focuses specifically on Gaza. And in that context, Tania is relied upon as a source of information and analysis on the situation in the Gaza Strip, both at home in Israel and abroad. And I also welcome Dr. Guy Shalev. He is the executive director of Physicians for Human Rights Israel and a research fellow at the Minerva Center for the Rule of Law under Extreme Conditions at the University of Haifa. He is a medical and political anthropologist who specializes in the intersection of medical professionalism, ethno-national politics, and bioethics in Israel-Palestine, and he received his PhD from UNC Chapel Hill. Tania and Guy, thank you so much for taking the time to join us today.
Thank you for having us.
Yes, thank you for hosting.
Absolutely. So what I would like to do as we get started with our conversation is to frame the situation a bit with some baseline understanding of the situation in the Gaza Strip before October 7th, because we certainly know that there was an urgent humanitarian situation in the Strip that predates the current war. And so I do think that it's important to start there. And I wonder, Tania, if you might lead us off with some background there.
Yes, definitely. So it's good to be with everyone today. And I want to just add our focus today, of course, is on the situation in Gaza, but I'm here in Israel, and I do want to say that we were very much affected, like everyone else here, by what happened on October 7th and the ongoing crisis, the hostage crisis. And so my heart is very much broken in many pieces and in many places at once. But I did want to start with that before I speak about the situation in Gaza. So maybe I'll just give a few anecdotes about the situation, because of course this is the sort of bread and butter of our work, and I could go on for days, but we have limited time together. So it is important for me to give a bit of an outline of what Gaza is. So, it's 141 square kilometers. It's just twice the size of Washington, D.C. So a fairly narrow, small place, bordered by Israel, Egypt, and the Mediterranean Sea. There are between 2.2 and 2.3 million people who live in Gaza. About half of them are children under the age of 18. And, even before October 7th, as Deborah pointed out, I mean, the situation was very difficult. You had electricity available only for about half the day. Many people didn't have sufficient access to water, households sometimes getting water access every 3 or 4 days. About 80% of the population was relying on humanitarian aid. And the reason for these difficult statistics is that, there are actually a number of different factors, but what we have been following at Gisha, of course, is what we refer to as the closure on Gaza. So there has been basically a process of isolating Gaza, of restricting freedom of movement over a period of decades. And that really culminated in 2007 when Hamas took over the territory. And a decision was made to restrict movement of people and movement of goods in a way that would put pressure on the population, a kind of logic of sanctions. So certainly there were also security considerations. But beyond that, kind of political goals and a logic of putting pressure on the population, which naturally, of course, led to a decline in the humanitarian situation. And I should say, even before that, Gaza is home to a population of people who consider themselves refugees. About 70% of the population are people or their descendants who came from areas inside of Israel and who were displaced to this narrow strip of land that we now think of as the Gaza Strip in 1948, a bit even in 1967. So it's a place that wasn't necessarily meant to hold so many people for such a long time in these kinds of conditions. And so the Gaza Strip has been associated as a place of greater poverty, lack of resources, lack of civilian infrastructure for a long period of time, including during the days when Israel had direct and internal control inside of the territory. And then after the disengagement, and then, of course, when Hamas came to power, again, the closure sort of putting extra pressure on the population. And so I think that having that sort of broad and wide context is really important to understand the situation and where we are today. I can answer more questions in detail, but that's more or less the big picture.
Thank you, Tania. That's very helpful, and I would encourage folks in our audience that if they do have more specific questions about the situation in the Gaza Strip before October 7th, you are, of course, welcome to put those in the Q&A in addition to other questions you may have, and I'll be happy to pose those. Let's turn to the situation following the horrific Hamas attack on October 7th. One of the key things that Israel did, as we know, is to impose a siege on Gaza, which of course went much further than the pre-existing closure in terms of the restrictions that had existed before October 7th. And so, Guy, I wonder if I may turn to you to talk with us a little bit about what the Israeli siege on Gaza has looked like, how it's evolved through the course of the war, and how the needs of the civilian population in Gaza are or aren't being dealt with, and what Israel's obligations are. So packed a lot in there, but I'll turn that over to you, Guy.
Right, thank you. Maybe I'll follow up on what Tania started in terms of context. We need to understand that when we're talking about the Gazan health system, it's a system that's under siege, under blockade for 16 years. So when we are talking about the siege of the past few weeks, it's on top of the development of this system. And particularly, we can say that since the 2014 attack on Gaza, this system could not get back to full operation. And so in the past 9 years, we're seeing a system that's in a constant crisis with, of course, additional attacks during these years. We had the Gaza protests on the fence that caused more than 9,000 injured, that flooded the hospitals in Gaza for a long time. And then we had COVID, and then another attack. So this is a system that's already in a very dire situation. Adding to that, the siege that was imposed on since October 7, and Israeli officials were very clear about it, saying no water, no fuel, no food coming into Gaza, and that had a very devastating effect on this already collapsing system, adding to the very big numbers of injured that flooded the hospitals since the aerial bombardments started after October 7. You should also add to that the number of chronic disease patients that are in normal times, which are of course not normal in any way. They need a permit to get a lot of the treatments that are not available in Gaza. We're talking about some 2,000 patients, and these are the very limited amount of patients that Israel defined as life-saving treatments that are not available in Gaza, and they are all, of course, stranded in the strip since these events started. And then when you're looking at after 14 days of no humanitarian aid at all that entered the Gaza Strip since October 7 until October 21st, that depleted the very low amount of material that the health system had already. Especially, we were talking about the hospitals in the northern side of Gaza, where they were also under attack and got evacuation orders very early in these hostilities, and were under a lot of pressure. Then we saw that some humanitarian aid started getting into the Strip, but it's important to understand the proportion. So the Gaza Strip is already under the years-long blockade, but still under that blockade, some 600 trucks would get into the Strip every day. And ever since October 21st, when some humanitarian aid was allowed in, we've seen one day we could see a dozen trucks, maybe the other day a few dozen trucks. And so if we think about a population of 2.2 million people and the very limited volume of aid that's getting in, it's very clear that the impact of that on the civilian population is very dire. When we're talking about the health system, it's important to, it's obvious, but still it's important to say that this is a civil system that serves the weakest people in the society. We know that from our own societies. So thinking about a civil system that's getting stranded in that way is very clear that the people who suffer from that are not only or maybe not at all Hamas fighters, but the uninvolved civilians of Gaza.
Thanks so much. Really appreciate that, Guy. And I am looking at the Q&A here. We're getting quite a number of questions that are already coming in. What I do want to do, because I did invite folks to ask questions about pre-October 7th, if they wanted to do that to better understand the background, I gave them the opportunity to ask those questions. And we've had some folks take me up on that offer. So I think what I'd like to do is pose 3 kind of pre-October 7th questions that we've gotten, and give both of you, I'll share those 3 questions and allow the 2 of you to answer whatever you would like from among those questions. I'm going to start with Alan Roskam, who asks, what did disengagement mean in practical terms? What was the level of autonomy accorded to Palestinians in Gaza? That's question number 1. Number 2 is from Nancy Bernstein, who asks, how did Gaza end up being completely dependent on Israel for water, food, fuel, and electricity? That's number 2. Number 3 comes from Irene Lieberman, who asks, if Israel was so successful in limiting supplies to Gaza, how was Hamas able to get the equipment and supplies to build the tunnels and all those weapons? Why couldn't they bring in materials that would benefit the people instead? So we've got questions from 3 of our audience members. And Tania, would you like to go first, and then to you, Guy?
Yes. Okay. So, I mean, in terms of the disengagement, I mean, yeah, it's a really good question. And, you know, I think that the short answer is that there was no autonomy that was granted in disengagement. It was really just a kind of, we say a reconfiguration of the forces that had been inside of the territory that then were still on the perimeter. And so, you know, that the main way that control remained in Israel's hands was over movement and access. It was actually the founding of Gisha was in 2005, just ahead of the disengagement, because anyone who was looking from the side realized that this would be what was happening, and that there was a kind of, in a way, a characterization of, let's see what the Palestinians can do with Gaza in this situation, and yet still sort of holding the reins in a way that would prevent them from really having the autonomy necessary to actually build up Gaza into Singapore, which was, you know, the sort of fantasy at the time. So very soon after the disengagement, you know, you had remaining restrictions on movement. You also had violent attacks by Hamas and other militants emanating from Gaza, and a kind of cycle of this violence and closure and retaliation, again, in a way that really never allowed Gaza, or more broadly, the Palestinian territory, to flourish. So there was nothing sort of handed over in terms of internal control. There was some symbolic, I would say, access at Rafah crossing, though again, this was all sort of remote control by Israel. And we have, you know, plenty of reports and things on this if people want to sort of delve into more detail. In terms of dependence for water, fuel, electricity, food, that question. So, you know, in the last years, I mean, basically since 2018, you did have some goods that started to come in through Egypt overland. Of course, before that, you also had a tunnel system that was built. When Israel imposed the closure in 2007, you saw a broadening of this illicit tunnel economy that ran under the Gaza-Egypt border. And so everything that was blocked from coming in via Israel started to come underground through these tunnels. And it's actually one of the ways that Hamas was able to build its its military capacities, its wealth, even because it taxed these tunnels and everything that came in through them. So, in terms of the closure working or not working, I mean, the Egyptian border has always been a sort of weak link. But in terms of electricity, the dependence really remained on Israel. There's one power plant inside of Gaza, and it needs fuel. And most of the years, fuel has come in from Israel for that power plant. And then there are electricity lines that were built, between Gaza and Israel. There used to be one dinky little line from Egypt that hasn't worked in years. And so really, Gaza is still 100% dependent on Israel for its direct electricity lines, and usually for the fuel that it needs to enter for the power plant. Food, a lot with food was actually coming in through Egypt recently, so that's not necessarily a dependence that was had on Israel. But again, Israel has de facto, or one could even make an argument in many ways, directly controlled what could come into Gaza. There has never been autonomy. I mean, even on the Egyptian border, everything that Egypt has done has been in close cooperation and coordination with Israel. So that's a sort of legacy, I would say, of the disengagement, that Israel never really relinquished control. I don't know if you want to add, Guy.
I can maybe add some details, for example, about the health field. That's our expertise, and this dependency is not even on Israel in many cases. We could feel that they are also dependent on us as an organization. We are having monthly delegations into Gaza of doctors coming in, doing training, doing surgery, doing training for mental health, and as all of us know, in order to be a medical professional or any kind of caretaker, training is fundamental, and you have to be up to date with international literature, with going into conferences, to fellowships, and all of that was never possible for Gazan caretakers. So basically, their only way of getting the very basic kind of capacity was by getting trained by people coming in from the outside. And for example, I can give an example. There was no capacity to do kidney transplant from a live person in Gaza for years. So they were dependent on one person coming from the UK, also doing the examinations needed to do the transplant in the UK, coming in and doing a few surgeries, and then have to go back maybe once every few months. And so if you think about dependency, you need to understand that that's a population, in the case of the health system, a whole system that has no connection to the outside world because of this blockade, because of people of Israel not allowing permits for people to go outside. A lot of treatments, like I said, are not available. And that's another thing. 80% of the people leaving Gaza to get treatment leave to hospitals in the West Bank and Jerusalem. They don't go to the Israeli system. They just need permit from Israel in order to get the treatments from the Palestinian system that is outside Gaza. So the control is really detrimental to a health system to develop and to provide services to the population.
If I could just add one thing here too, I would also say, I think that a lot of people have this question about, why didn't Egypt sort of step in, or why hasn't the international community stepped in, or why didn't that border sort of open? And I do want to say also that it's really important when we're talking about Gaza to look at Gaza's connection to the West Bank and to and as part of it, East Jerusalem, and also to Israel. So in terms of dependence, it's not just Gaza's dependence on Israel, it's the fact also that Gaza and the West Bank have been one unit. And that's true. Certainly, Guy, I'm sure, can speak about the medical sector, but also, for example, the academic sector. So you had universities that were built in Gaza and in the West Bank, and these were systems that were meant to complement one another. Specialties of sort of medical treatment that people can reach in East Jerusalem and the West Bank that are not necessarily offered in Gaza. So Israel's closure on Gaza also has split apart the Palestinian territory in a way that has been certainly detrimental for the civilian population and development, the humanitarian situation more broadly, but also on a social level, on a cultural level, on a political level. You've seen this sort of tearing apart of Palestinian society over the years, which unfortunately, in my analysis, was done on purpose. One of the political agendas that I alluded to when I started talking, there were, of course, the security aspects of keeping Gaza closed, but I think it's no secret that one of the political agendas has been to sort of crush the idea of Palestinian self-determination and Palestinian political power, which was made more convenient once Hamas took power. So we can get into that more, but it was important to me to also put into context that the closure isn't just about isolating Gaza from Israel, it was also about isolating Gaza from the West Bank.
Thanks to both of you for that. The next question that I want to, the next topic that I want to raise is the issue of the hostages. And this is something that is certainly of interest to some of our audience members, many of our audience members, I'm sure, as well. The questions I want to ask are, what we know, if anything, about their well-being, to what extent the war and the siege are likely impacting them. And then a couple of questions from our audience members. Ross Herman asks a question specifically about the Red Cross, the ICRC, and whether they have demanded access to the hostages that are held by Hamas. And Mark Israel asks if you could share how your two organizations are working to address and publicize the medical needs of the hostages that are being held, with the understanding of that many of them apparently have severe medical conditions that need to be addressed. So Guy, why don't I turn to you first on the issue of the hostages?
Right, so the issue of the hostages is in our point of view, maybe the most important aspect that Israelis and people around the world should be worried about, thinking about 240 people stranded, held by Hamas, dozens of kids and the elderly people, like it was said here, with the medical conditions. And in terms of our reaction to that really disaster, we immediately reached out to members of hostages. In the beginning, there was not even like a group of the families of the hostages, so we had to try to collect from each family the medical needs for every hostage, and we communicated the list of all required medicine into the Gaza Ministry of Health. We tried to make sure that this information goes further into the military Hamas that are, of course, holding the hostages. And we've been trying, unfortunately unsuccessfully, for the past 6 weeks to get like the actual medicine in order to make sure that the hostages get it. We are very concerned about what the war might do to the hostages and what the effects might be of people held in there in Gaza. We all know that a 1-ton bomb falling from an airplane cannot distinguish between a Hamas fighter, a Gazan family, and an Israeli hostage held in Gaza in locations that are unclear to everyone. So, of course, these attacks, these very aggressive attacks on Gaza, risk the hostages. We hear every day a lot of the families, not all of them, a lot of the families of the hostages pleading the government for a ceasefire, pleading the government to put the safety of their family members first before any ideas of revenge or any ideas of trying to annihilate Hamas. And we support them. We go to the demonstration. Voice that should be heard all over the world to save these people. Maybe I didn't say the most important thing is that people, the Hamas that is holding these people, these are the people that we should first be blamed for doing this crime against humanity, this crime that's clearly every day that they are held by Hamas is a violation of international humanitarian law. And this is maybe the first thing when we talk about hostages is talk about the people who actually took them hostage and hold them there for so long.
Absolutely. Tania, did you want to add anything on the hostages?
I don't think so. I think Guy said it very well. I mean, we're all terribly concerned. I would just emphasize again, I'm very concerned about their well-being. The kind of extensive bombardments that have taken place over the past 6 weeks have really pulverized the strip. The north is completely unrecognizable. And yeah, people don't know where people are being held. I mean, it's true that Hamas is holding many of them, but we don't know how many are being held by others. You know, maybe even kind of random people throughout the strip. So I definitely think that there's cause for a lot of concern about their well-being and their safety. And I echo what Guy shared about the families. I mean, I'm not sure how much that's reaching the US and media there, but just the families are just pleading with the government to prioritize the well-being and the safety of these hostages. And the message that I think you know, Israeli leaders have been saying is, yes, we're prioritizing that, but on the ground, what we're just seeing is just these massive bombardments. So you know, we're hopeful that there will be some kind of deal, but yeah, I think our hearts are really with these families because it feels like the government is not doing enough to release them.
Indeed. Thanks for sharing that. And I'm sure many of our viewers are, you know, probably aware of some of the dramatic scenes that have just taken place in recent days in the Knesset, for example, with families of the hostages really pressing their case and making clear the extent of their frustration with the Israeli government on this. The next question that I want to ask you has to do, I think it's a good segue, Tania, from the point that you just made about northern Gaza. And would like to get a sense from the two of you about the situation in these two. We often hear about, you know, the north versus the south, Israel having given the evacuation order to northern Gaza, Gaza City, people moving to the south. So questions include things like, you know, how many people have stayed in the north and why? Why would they have stayed? And then the next question is how concerned are you now that Israel is you know, putting out leaflets saying that people need to leave particular neighborhoods in the south, about what's going to happen in the south and where people at this point would be able to go?
Yeah.
Guy, you start, or sorry, either one.
Go ahead. No, Guy, please.
I can start. Yeah, so the information about how many people are left in the north is unclear. There are different statements and different, basically they are all just evaluations of the information that's not very clear. Also, I might add, getting any information now from Gaza, any statistics now is very hard. The Ministry of Health in Gaza, that is a very trusted source for example, the number of the people who died, has stopped publishing these numbers since they don't have access. The way that they collect these numbers is by getting the numbers from the hospitals, but now they don't have contact and communication with some of the hospitals, so they're finding it difficult to evaluate the number of dead in Gaza. But that's only just to show that information in of course in a war zone, and especially in a war zone such as Gaza in these days, is very hard to even understand what the scope is. And so the people that are stranded in northern Gaza are, I think, now in the worst condition in terms of the people in Gaza. They are there with no water, no clean water, no food, no aid coming in. No hospitals, basically. There are all the hospitals of the north have stopped operating properly. Some of them are still giving some very basic first aid, and our hospital was attacked 2 days ago. And Auda Hospital was attacked yesterday. So we are in touch with our colleagues in there. We're getting the information from there, but they're all just locked in those institutions encircled by the military. It's very important to understand that it's not like people in the north believe that the south would be safer for them, because we see that a third of the people who died since the October 13 evacuation order of the north were in the south and in safe zones that Israel defined as safe zones. So people know, people talk to each other, people see that if I move to the south, it doesn't necessarily mean that I'll be safe. And also to get yourself to the south is very difficult these days. Some people cannot move. Some people just want to stay with a family member that cannot move. And in many cases, we're talking to people, it's a family decision. So the whole family say to themselves, well, if we die, at least we'll stay together. And then the whole family needs to decide whether they move or not move. And then I cannot even imagine how hard these decisions can be. And also, Israel put checkpoints between the north and the south, so people are worried to go through these Israeli checkpoints. And all this is to say that the people that stayed in the north cannot be labeled as Hamas fighters. A lot of civilians are there, and according to international humanitarian law, they're still protected. The fact that they got an evacuation order but failed to follow them for different reasons doesn't make them a legitimate target for military action. And you can add also to that the whole push of people from the northern side to the south side was also made by limiting what kind of products and aid go to the north from the very beginning. So the very little aid that got in was through the mechanism that's distributing this aid is by UNRWA, and they were ordered not to bring any aid to the northern side of the strip. So we know that hospitals in the northern side didn't get any aid and anything throughout these weeks. So the pressure is very hard on people, and it causes a population density that's really unimaginable now on the southern side of Gaza. We know of apartments that usually hold like dozens of people, and now we have hundreds of people in the same houses. People left their houses without warm clothes, and then we had a storm here in the last few days in Israel and Palestine. So people even need like warm clothes to survive and for their kids to survive. We know that there's risk of disease and contamination now, especially in the south where the density is very big. Yeah, so I guess I'm sure Tania can add to that.
Yeah, maybe I'll just say a few more words about what's going on in the south. I mean, I think that now there's this perception that, okay, now aid is flowing into the south, maybe things are better there. And yeah, I think that Guy gave a good sense of the density. I mean, there are about 900,000 people in UNRWA shelters alone, in 154 shelters. So almost 1 million people in 150 shelters. They're talking about 1 shower for every 700 people, 1 toilet for every 150 people. And again, in terms of the aid that has come in, a little over 1,000 truckloads, so 1,300 truckloads since the aid began coming in. And that would be less than 3 days supply for the entire strip in about 45 days. So again, you can sort of imagine, people are hungry, they're thirsty, they don't have the basic supplies that they need. And we've now only seen fuel going in just the last few days. So, severe shortages of fuel, which meant they're weren't bakeries that were operating in the Strip. There's just a few bakeries left operating in the South, none reportedly open in the North whatsoever, no flour available in the North whatsoever. And yeah, without the fuel, you're talking about really critical civilian infrastructure that wasn't functioning. So water desalination facilities, sewage treatment plants, the communication system, which of course completely stopped functioning for several days until UNRWA was able to deliver some fuel to it. So it's a situation really, I mean, we're saying all of these facts, but I also want to emphasize that, this is completely unprecedented. We talked before about what happened before October 7th, and the situation was already not good. And I think that people tend to think of Gaza as this place of poverty and destitution, which is true. But nothing like what we've seen over these last weeks. With this kind of hunger and thirst that people are experiencing, it's really a devastating situation. And I think the focus on humanitarian aid is important because we're trying to see what can be done about this. But I think we also need to take into account the long-term consequences. When we're talking about the North and the South being split, the housing is pretty much destroyed in the North. There are estimates something like 50% of the homes are just gone, but also the roads are gone. And so if Israel does really move into the South and start cleaning it out like it's done in the North, there's nowhere for these people to go. They can't go back to their homes. And Israel is saying, for example, in the humanitarian pauses, if the deal comes through, people will not be allowed to go back up to the North. But even if they could, there are no homes to go back to. And so if we see the kind of destruction in the North that we have, in the South that we've seen in the North, you're talking about a place that is just, it's already uninhabitable, but will be even more so. So yeah, we're really struggling to understand the logic of what could happen next. There have been some plans and maps released of this very, very small area near the coast that Israel is calling the humanitarian zone, an area called Al-Muwasi. You physically couldn't fit 2.2 million people into that area. So it's really just, catastrophic in proportions. I just can't even emphasize enough.
If I can add, we should be careful about thinking about this humanitarian crisis as a collateral damage or as a side effect. It's not like this is something that's not anticipated. It's not like it's something that's not. We know that some very high-ranked officials in Israel are saying that this is deliberate, that this is a way of weakening the enemy. And this whole distinction, which is the very basic idea of humanitarian law, distinction between your enemy and civilian population, is something that's totally disregarded in this effect. They know that 2 million people are now starving and at the risk of being horrible disease outbreaks, but it's still, this happens. It's not a side effect.
All right. Thank you both so much for that. I do just want to tell our audience members who have put a huge number of questions into the Q&A that we will not be able to get to all of the questions that you've submitted today. I'm going to do my best in the time that we do have left. But we have a number of questions in the Q&A that are focused on Hamas and the question of to what extent Hamas should be held culpable and what they've done. And so I'm going to pose not all of those questions, but a number of those questions from the Q&A, and then turn it over to Guy and Tania. So Jessica Rowe, for example, asks, what has Hamas done to prevent the humanitarian crisis and or mitigate it, and why are they not being held responsible? Sharon Alexander says, when I talk to Israelis, they tell me Israel is not responsible for the lack of resources delivered to Gazans. They say Hamas has stolen everything. How would you answer them? Henrietta Wolf says, Israel keeps defending their actions in Gaza by saying that Hamas hides among civilians. And that's the reason that Israel continues to do what it's doing. Is this legitimate? And the last question I'll pose on this line of questioning is, do you think Hamas is actually holding back fuel, food, other necessities? Are they stealing what is being allowed to enter the Strip? So who would like to jump in first on that?
I can start by saying that as a human rights organization that's based in Israel and attends to people, everyone basically under the control of Israel, Palestinians, residents of Israel, asylum seekers in Israel, prisoners. I'm not sure even why I need to explain that, but it's very clear that human rights organizations are really concerned about the human rights of everyone here, and of course about human rights of people in Gaza, and whoever violates them is our concern, and we are very worried, and we condemn any human rights violation in these hostilities. One of the things that we are now documenting in PHRI is the violations that Hamas has done in the October 7 attack. So we just issued a paper about Hamas attack on medical facilities and medical personnel during these attacks. And when we talk about the attack on military medical facilities, it is a principle that is applied to everyone, and we should condemn and make sure that health facilities and health personnel are protected in any circumstance. In terms of the specific allegations here in the questions about what Hamas is or isn't doing, we are really, one of the struggles is to validate information that's coming out. We know that the spokesperson of the Israeli military is issuing statements almost every day, publishing videos. We're trying to get these evidence validated by a third party. And this is not just because it's the Israeli military, that's because warring parties and militaries should not be trusted in the information that they provide while they're at war. It's true for the Russian military, for the Ukrainian military, and for the Israeli military, of course, for Hamas fighter and whatever statements they issue. And when we try to validate these claims, for example, at the very beginning of the hostilities, the spokesperson of the military said that Al-Shifa hospital is a command center for the Hamas, with infographics and images of the hospital and where the command center is. And the Israeli military entered the Al-Shifa hospital, and some of the specific places that they said that the command center is located has already been searched by the Israeli military, and they didn't find anything. I'm not saying that they will not find anything, but what is important to understand is we cannot address something that's not validated. We need third parties, research, and people on the ground, and validating every claim that is used in this war, because this is the responsible way to react to violations and to protect human rights.
Tania.
Yeah, so I mean, in terms of, Hamas stealing goods and things like that, I mean, it's well documented, and Israel would agree, only 1,320 truckloads have come in the last 45 days. So that by any stretch of the imagination is not enough for 2.2 million people. We haven't seen any allegations that anyone has taken any of those items or, any of those products. It's just not enough. And like was said before, the point was to lay siege. A decision was made to cut a supply of electricity, to at first cut water supply. Some of that water was later restored, to not allow in goods, to not allow in fuel, until the situation got so bad, of course, that President Biden stepped in and asked Israel to allow some goods to come in. So it wasn't a question of the diversion of that aid. It was really a deliberate policy to lay siege and put pressure on Hamas and on the civilian population. In terms of, their responsibility, of course, they have responsibility. I, as an Israeli, we're an Israeli organization. I don't have any contact with Hamas. I don't have any way to lobby Hamas. I want my government to do the right thing. And right now they're making choices in this war, and they've made choices over the last 16 years in how they operate vis-a-vis Gaza. And so that's what my primary focus is. That doesn't mean that there aren't a host of other actors that we haven't even talked about today. But that's, where my focus is. And I do think that, I hold Israel to a higher standard. If we believe that Hamas is a terrorist organization, I don't want my government to be acting like they do. I don't want people to, I don't want to see civilians punished on purpose. I don't want to see them attacked or put in harm's way. I would like my government to do really everything in its power to make sure to distinguish between combatants and civilians in this war. And so that's, I think, a really basic request, that we should all be demanding of our governments. In terms of what can be done in that regard, I think a lot more can be done. The US has really been key here in trying to step in and trying to provide, more or get Israel to allow more. And I would say, in terms of security and long-term security, it's in Israel's interest also to, to see to the civilian needs of the population. There can be no security that will come from children being killed or being hungry. It's really in nobody's interest for this situation to continue as it is.
Thanks so much for that. The next question that I want to pose, and I'd like to pose it to both of you, is the prescription for what should happen now. And so Bruce Shenetz, I don't know if I mispronounced his last name, notes that Gisha, your organization has taken the position of calling for an immediate ceasefire. And I know, Guy, that is true of PHRI as well. As I will just note that we here at J Street are not calling for an immediate ceasefire. Because we do recognize the importance for Israel's security of degrading Hamas's capability so that something on the order of October 7th cannot happen again. But we are very concerned, obviously, we're having this webinar about the humanitarian situation in Gaza, very concerned about the way that the Israeli government is waging this war. We have called for substantial humanitarian pauses, and we know that the Biden administration has done that as well. But I would like to give the two of you the opportunity to talk about how your organizations see the situation and what should happen now vis-a-vis the humanitarian crisis and alleviating it. Guy, did you want to go first, or Tania?
Yeah, I can go. So I think it's let's think about one story that became very famous in the past few days, and that's the premature babies that were stranded in a Shifa hospital with blackouts in electricity, and they were really at risk of dying. 39 originally, then 4 reportedly died. We know that 31 or 32 were evacuated to Egypt. It seemed like the whole world was holding their breath to see if these 30 premature babies are going to be victims of this war, that in a world that they never chose to be born into, with definitely nothing to be blamed of the October 7 attack or any other grown-ups issues in this world. And that we should remember the thousands of children died in Gaza during this time, but these 30 premature babies became so important to so many people. And I think if we think about what their story and about saving lives of also not only these 30 premature baby, that we worked so hard for that, and we're very happy that some of them are safe now. By the way, they're safe without their parents. Only 5 women were allowed to escort them, so that they are safe without their parents. Cannot even imagine as a father think of premature baby being evacuated to a different country without family. But we cannot stay in this imagined world that this war can go on, and we're not going to see so many victims that are totally there's nothing to blame for. We cannot blame them for anything. The only way to save more children, to save the people that are totally uninvolved in this, is stop the fire right now. There is no way to attack. Now it's also half of the size of the Gaza Strip with more than 2 million people. No way to attack this small territory with so many uninvolved civilians without causing so much damage, so much sorrow, so much pain, that everyone in this region will keep paying for this for many years to come. I'm saying that as an Israeli. I don't think that bombing with the goal of annihilating Hamas will now lead us to a better place that we used to be a few weeks ago, or when we used to be before the previous attack on Gaza. If we care about human rights, if we care about people, about children, about whoever we can imagine the lives of people in Gaza, we need to call for the Israeli government to stop the fire, to call on Hamas to immediately release the hostages, and to really push for international interference, push for international kind of conference, horrible situation that will not cause more people and more kids and more babies to be in this unimaginable situation.
Tania, I'm going to give you a chance to answer the same question, but I do want to throw in one additional piece as you answer, and just give Guy a chance, and then that'll be our time, even though we have many, many more questions and things we could discuss. But we have a question from Meryl Glustrom, who notes that emotions are running very high in Israel. Presumably, you can speak to this, most Israelis don't share the viewpoint of your two organizations. And how are you holding up? How are your organizations holding up? Do you feel besieged at this particular moment? So we'll kind of, wrap up with your prescription, Tania, and then, and then back to you in a sort of personal way. So Tania, over to you.
So yeah, I think Guy said everything really well that I agree with, and I would just add that it is a sort of unique position for a human rights organization to take. We don't necessarily always call for a ceasefire, and I think that if I were persuaded that the parties were fighting according to the rules of international law, we wouldn't have said anything, because it's not our place. And I think that from what we've seen, it's pretty clear that both of the parties, it's actually absolutely clear that both of the parties are not able to fight this war in a way that follows the law. And I would add that the objectives that have been laid out about destroying Hamas, I don't know what that means. I don't think that there is a military solution, unfortunately. And I think even more worrying that there's really no plan for the day after. And the way that I know that is that because the fighting and the way the fighting is taking place, there almost is no day after. The strip will be uninhabitable, for the very near future. If there are no hospitals in the strip, if civilian infrastructure is damaged, homes are damaged, there's nowhere to go back to. So to me, that also raises a lot of red flags about the goals and the motivations of this war. That's unfortunately not just about security and not just about degrading Hamas's capabilities. So that's some of the reasons, additional reasons, in addition to what Guy said, that we're also calling for a ceasefire. And in terms of how we're doing, I would say at Gisha, we have a field coordinator in Gaza that many of the J Street family have met, during other webinars and during visits to the region. And so, him and his family are really close to our hearts, and he's in danger, and that's just been really, really difficult for everybody. There's really nowhere safe in Gaza. And he's there with his young children, and it's just an absolutely heartbreaking situation. So in addition, of course, to what we're holding inside of Israel as Israelis, our hearts are also there with him. And I think that like I started, I mean, our hearts are really shattered in so many pieces. But I think that the points of light are really, thanks to the community that we're operating in. There's a number of organizations inside of Israel that we're working together with, trying to create conditions for a better future. And I would say also our partners abroad, including J Street. I really think we have to do a lot of work and huddle together really closely at this time, because it's harder and harder for all of our societies to see a way forward. And I think a way forward is really for shared security and well-being for everybody living in the region. So thanks for everybody for all that you're doing in that regard.
Guy, you have the last word.
Yeah, so it's not easy. It's not easy right now in Israel to speak up against what the overwhelming majority of the Israeli public is supporting right now. And like Tania said, it puts us in a very hard position as family members of staff members. We have a staff member whose close family member is held hostage. We have few staff members that lost friends and family in the attack of October 7th. And yet we are getting hate mail and hate messages. I'm getting a lot of hate messages on social media claiming that we don't care about Israeli lives because we ask for a ceasefire. And that's also, but it also puts us in a situation where we feel the obligation to keep challenging this consensus that's very threatening and very it causes a lot of concern. Our colleagues, we are an organization of a lot of medical doctors and medical staff workers, volunteers, and our Palestinian citizens of Israel, doctors and nurses, who are together 50% of the personnel of the Israeli health system. They cannot say anything. There's maybe that's their topic for a different webinar about the censorship and the really how Palestinian citizens of Israel now cannot even post on social media any empathic emotions to their families or compatriots in Gaza. So we see this also as an obligation to speak up for the people who are now silent. I know that every time that I say something, I'm getting a lot of messages that also makes me stronger, because thank you for saying that. We cannot say that, and thank you for saying that. And it's not a coincidence that we are today two executive directors of organizations who are Jewish Israelis who are okay with being on camera saying these things. It's much harder for Palestinians to speak up these days. Yeah, so I guess this is also why it's so important for us that you invited us to this webinar, because we want people all over the world to hear this voice as well, and not only the Israeli government or the Israeli mainstream voices, and help us really stop this war.
So I want to conclude, even though we could keep talking for a long time, I do want to conclude and just say a couple of things, one of which is that a couple of topics have come up at the end in your comments that we will be exploring further in the future. For example, the situation in terms of constraints and constriction of democratic rights in Israel, and in particular, the impact on Palestinian citizens of Israel folks can look forward to a subsequent webinar on that. Tania, of course, raised the issue of day after, whether there will be a day after, what that might look like. We'll certainly be discussing that further as well. But I do just want to give my heartfelt thanks to both of you for your critical voices in this time, for the work that you do, for the hope that you help to bring us here in the United States as we watch what's unfolding, and our hearts are broken, both for Israelis and also for Palestinian civilians in Gaza. We are so grateful to you. We are so committed to continuing our work together. And thank you for taking the time, both of you, Tania and Guy, for joining us today.
Thank you so much for your
Thank you so
support.
much.
So with that, that's all the
Thank you.
time we have for today. And thank you to our audience so much for joining us. Take care, everyone.
Bye-bye.